Hi everyone, thank you for joining the presentation. I'm Shahid Khan and here I will present my latest paper which is on clutter suppression in 3D in vivo medical ultrasound using in-phase extended Frank-Wolfe method. My co-authors are Jing, Lamia and Professor Jongchulia. Introduction. As we know, 3D echocardiography has emerged as a powerful tool because it offers volumetric information and improves spatial context. However, several challenges remain, particularly clutter suppression and low signal to noise ratio. As can be seen in these figures, when you compare the quality of conventional 2D and 3D echo, 3D echo is often produce poor quality compared to 2D. This is due to the fact that we have a sparse number of transducer configuration and reduced frame rate in 3D compared to 2D. So to remove the clutter, in 2D, we have various methods, and these methods rely on the assumption that you have high frame rate. And the techniques that are designed for 2D are often unsuitable for the 3D clutter removal or the clutter removal in 3D because of the incorrect assumption of the high frame rate. To deal with this, we design a spatiotemporal clutter suppression technique using in-phase extended Frank-Wolfe method. In order to evaluate our method, we utilize this dataset, and the dataset is composed of several 3D echo scans that were collected from healthy volunteers using a commercial ultrasound system. During the scan, the care was taken to include entire left ventricle cavity within the pyramidal sector volume and also ensure that there is no artifacts like stitching artifacts and the ECG is of good quality. Furthermore, we also maintain the best optimized frame rate possible for individual person, and it was kept constant throughout the scan. To further enhance the quality of the dataset, we introduced a new print sheet which is placed on the top of the chest and in between probe to mimic mild, severe and moderate level of image degradation, which further enhance the artifacts, so that we can see once we actually apply this algorithm, we can see the effect is generalizable across different imaging quality. The data acquisition protocol was approved by the Institutional Review Board. Some example scans are shown here. No new print means the baseline, and we have mild, moderate, and severe cases. For the data related uh, details, please refer to these citations. The proposed method, as I said earlier, exploit the low rank and sparse component decomposition techniques using in-phase extended Frank-Wolfe method. For that, we assume a model in which a sequence of 3D echocardiography volume is um, is um, is defined by X, and the objective is to filter this volume and produce a clutter-free version. For that matter, first we need to understand what is the configuration of the data. So at each time point, the system generate this volume of scan, and in tau period we have several number of volumes. The collection of volume is fed to the proposed algorithm, and we get a filtered version of the volume, and it is performed in a overlapping fashion. So the proposed method exploit both the spatial as well as the temporal information to generate a filtered version. The inside the proposed algorithm, we actually consider not just only the spatial information but the temporal, and to do so what we did is we extract theta number of adjacent slices from each volume and arrange them in this configuration shown here, where tau is the time and theta is the number of adjacent slices taken for the processing. In a typical 2D ultrasound, we don't have tau, and this tau, we don't have theta, and tau is usually quite high because of the high frame rate. While in 3D, if you use large tau, it, it, it's not suitable because within the tau amount of time, the large tau, we can see a big change or a rapid change in the slices because the frame rate is low. So uh, to make this configuration, we consider tau number of temporal frames and theta number of spatial slices as shown here, and then we rearrange it into Casorati matrix format, where LNA represents the lateral and axial dimensions, while tau and theta represents the time and spatial axis. Then we apply in-phase extended Frank-Wolfe method to extract low rank and sparse components, and it will result into a vector of size L by A. Then we convert it into this image format, where into L and A size matrix, and the same process is repeated for all time steps in an overlapping fashion as shown here, and it results into a filter tensor. Results. So here I will show you some qualitative results in comparison of the original images. For instance, here I actually pick a single slice from a 3D tensor. The image is from the baseline baseline scan, where no new print sheet was placed between the probe and the chest. And again, you can see the noise level is quite high, and there's a lot of clutter here in the original image. After filtration, you see that the clutter will be suppressed and the anatomical structure will remain there. So this is the filtered version, um, and let's see another example from mild case. So this is further degraded image. It means instead of just simple 3D scans artifacts, here we are further reducing the signal strength with the help of a new print sheet. So mild means in mild case we have 1 millimeter thick new print sheet between the probe and chest. Here again, the proposed method significantly reduced the clutter and preserve the structural details. Same case in the moderate and severe. Now let's see the comparative evaluation, where we compare our method with the rapid technique. Rapid is state of the art clutter suppression technique designed for 2D ultrasound. It does not actually utilize the spatiotemporal filtration, uh, which means no theta is there. So either we have to increase number of time frames during the filtration process, or we have to actually compromise on the number of frames. For a fair comparison, I actually use 6 time steps for rapid, while in the proposed I use 3 time steps. For rapid actually I use 9 time steps, and for the proposed I use 3 temporal and 3 spatial components from each frame to result in the same size Casorati matrix. So here you can see in the results that the baseline have this anatomical structure and clutter is on the top. So although rapid suppress the clutter, but because of high very low frame rate, the
this valve actually show rapid motion, and it is filtered out by the simple spatial filtration technique or simple temporal filtration technique. Whereas in proposed method, which exploit both the temporal and spatial filtration, it preserves the structure quite well, and similar results can be seen in the case of mild degraded or moderate or even the severely degraded case. Especially in the severe case, you can see the rapid actually generate saturated image, and it blur out all the structural details here, while uh, proposed method not only suppress the clutter, but preserve these fine details, and this make it suitable for the 3D scans. Lastly, I would like to conclude my research on these points. Here we present a novel spatiotemporal clutter suppression technique uh, designed for 3D echocardiography. The technique rely on the low rank and sparse approximation using in-phase extended Frank-Wolfe method, and the proposed method suppresses the clutter while preserve the important structures, and it opens up a new venue for enhanced 3D ultrasound interpretation.